All right. Hi, my name is Joshua Moore. I'm part of the MPH program at Liberty University. This is actually my last assignment, so I'm very excited to get through this and be graduated. My focus as an MPH was actually nutrition, so I did a lot of focus in my project on how nutrition can impact people. So my project was over hepatitis B. Hepatitis B is something or it's an infection that can affect the liver. And there's ways that like you can prevent liver disease and everything. And that's where I came into play, where I would help patients with nutritional plans. So if not treated in a timely manner, hepatitis B can lead to liver disease and liver failure. The enzymes that are within your liver can build up, causing liver cancer, which will then eventually lead to like really bad scenarios. There's two types of hepatitis B actually that we looked over. It was acute and chronic. Acute being a newer infection. They just found it, and chronic being 6 months within and even longer. The transmission of this disease, there's many ways that it can happen, but it's usually through bodily fluids, whether it be sexual contact with someone who is infected with this disease, a patient who is infected and possibly shares needles with someone who isn't infected. Both of those are very common with this disease. Some of the other ones can just be from other bodily fluid that has been shared from one patient or a family member to another. The testing that we go over is a lot of the hepatitis B surface antigen, the antibody test, the core antibody and antigen test. Those are the ones that we went over. They're the serological testing that hepatitis B really looks into. And as you can see, that's all on slide 2 right here. Moving on to slide 3. On this slide, it goes more into depth of where I did my practicum. So the practicum that I worked on was with or partnered with the Mid-Ohio Valley Health Department. This is actually in Parkersburg, West Virginia. This is where I grew up. So it's very nice to get back to that area to kind of see like how this area is affected by this disease and infection. The people I did get to work with are people such as like clinical directors and nurses. So the clinical director had me set up with all this. She trained me on everything. And the nurses are the people that we were in contact with when we needed to get with patients on treatment options and testing. On slide 4 here, we did a lot with recommending vaccinations. So with the Hep B vaccination, it is recommended for all ages now. The CDC just came out with a new guideline. They didn't have that 19 years of age to 59 years of age. It wasn't necessarily recommended for them, but they are actually now recommending it for all ages. If you are infected with this, obviously you have antibodies within it, so they did not recommend it for them. But anybody who is not infected with it that is over the age of 60 years of age, it is not recommended for them unless they are in an area of risk factor, whether that be like sexual contact with their partner, a family member who has it that they could possibly spread bodily fluid to them, things such as that, like needle sharing and everything. Then that would be recommended for those people, 60 years of age or older. So a lot of the studies I looked into showed that the years of effectiveness of this disease usually was 20 to 30 years. Once that happened, they like the effectiveness of the vaccination started wearing off, and it wasn't really as effective as it was when it first, like all 3 doses were given to a patient. There is a lot of like research going on to see if like boosters and everything are going to happen for vaccinations, but they haven't really gone into depth much with that, and not enough testing has been done to really see if any like side effects or anything would happen if they would give another Hep B vaccine. So data collection for this project. A lot of the data collection was done through WebEds, which is our system that we used at the Mid-Ohio Valley Health Department. Basically, it covers like all the West Virginia patients that are in every surrounding county around us. So it stands for West Virginia Electronic Data Surveillance System. Basically, what we did with that is it's one specific area that all the information of one patient can go to. Once we would figure out like a lot of the lab results, which it's who Canton Clark Medical Center and Lab was, we would use them to receive a lot of our testing and everything for patients for hepatitis B. Once they would send us over the test results, we would enter that information into WebEds there, so that way like everybody in the county that is a health professional is able to access that. A lot of the stuff that we did on there was a lot of like calling patients and receiving information from them as well, whether that be like contact with another patient or not another person that patient was in contact with to see if they may need testing, see if there's like outbreak scenarios and everything on this. So the samples for this project was patients that were 20 years or in their 20s to 70 years of age. We had many different people in that area, like spread out between all those ages. So a lot of our patients were actually from a homeless shelter. We linked a lot of them to one specific one. So there are like hepatitis B vaccinations going to that specific area to see if we can kind of slow down new case numbers from coming in and everything. A lot of that's from like needle sharing, bodily fluids being spread, like that kind of scenario. Caucasian males were our like number one group that had hepatitis B infection. Not sure exactly why this happened, but that was like our top prospective person that would come in and like test positive for hepatitis B infection. So this ran from basically the whole semester, December 2021 till April 2022. I do have plans of continuing this project. I will have jurisdiction over more counties soon, just because I was an intern, so I didn't really have a lot of access to that stuff. But getting more information from these other counties, I think, will make a huge impact and be able to make this project like extend over many years, I'm sure. So basically what we did, I'm just going to wrap up here. A lot of the nutrition plans that we provided in education to these people were given as like free of cost. It was just a clinical that was ran by like our nurses, and my focus being in nutrition, I was able to provide nutritional factors. The nutrition plans that I kind of provided was more of like a Mediterranean diet. That kind of stuff helps protect your livers, things such as like fish, broccoli, rice, those kind of things. It kind of helps protect from getting fatty liver disease and leading to liver cancer. Other than that, I do believe this project was a little difficult because I did do some remote, some in person. So it was a lot harder for patients who we were not able to get in contact with because I couldn't physically go to somewhere and talk to them like face to face. So that was definitely something I saw as a barrier that could have been avoided if I was located specifically in that area. But I am moving to that area, so that's why I want to continue this project to see if more face-to-face contact would help better results within this project. Basically, with I guess some of the things that were really good with this project is I didn't have a lot of knowledge of hepatitis B, so getting trained in this area was amazing. I learned a lot from it, and working with the people that I did, they taught me basically everything I know about this disease now. So I'm very excited to continue this project with them, and I look forward to making like an impact in a town, especially one that I grew up in, and trying to have something that can, I guess, make the town a better place and put a positive impact on like those people and basically allow them to live better lives. It was definitely like a fun project, and I cannot wait to continue it and keep going forward with it. Thank you.